Do you like your nose? Have you ever thought about making some changes to your nose? I mean, we all like to look our best. Well, that's exactly what we're talking about today with our coastal expert from Renewal MD. And of course, Dr. Michael Huntley joins us again. It's great to see you, Dr.
Good to
Huntley.
see you, yeah.
So let's talk about it. It's called a nose job, right? But
Right.
I know there's a specific term.
Yeah, the official word for it is rhinoplasty.
Rhinoplasty. So what exactly is a nose job?
Well, basically the nose is a prominent feature of anybody's face, and oftentimes the nose isn't quite what we would like. You know, it's the wrong size, wrong shape, or there's some significant differences from the ideal. And in those situations, a rhinoplasty or a nose job is designed to change those features, to optimize them, to give the patient what they want.
Who could benefit from rhinoplasty?
Anybody who wants to make adjustments to the shape and size of the nose, a rhinoplasty is an appropriate procedure. There is also a functional component to rhinoplasty. Airflow through the nose is controlled by the nose itself, and if there's internal structural problems, if the septum is crooked or thicker than it should be, or the turbinates, which are side projections from the nose, if they're too big, then they take up space, and airflow through the nose is not ideal. So often with a rhinoplasty, those other aspects are looked at and treated if necessary.
And there are all kinds of things that can be done, no matter if it's just thinning out the tissue or making it maybe a little thinner in here. I mean, there are all kinds of different procedures and different things that can be done.
Right, that's correct. Sometimes it's a bony structure of the nose. The upper part of the nose is made of bone. The lower part is cartilage, which is flexible, but it does have structural support. So you can treat each individual part of the nose according to what the needs are, you know, to get the optimal shape and size. Usually I do them through an open approach, you know, where we come under the nasal tip, inside the nostril, and we reflect the skin off the nose so we can see exactly what the anatomical arrangement is.
Because I was going to ask you, what exactly is involved? Because it's a process.
Right, exactly. It's a general surgery procedure. Usually you're asleep for the procedure. Once you're asleep, we put local anesthetic in, so when you wake up it doesn't hurt too much. The incisions typically come across the columella, which is the central part underneath the tip, and extend around the inside of the nostril so we can reflect the skin off the nose. And we can look at the structure and deal with the issues that need to be dealt with. And that consists of taking down the hump. You know, if there's a significant hump, we remove that.
Is that all about just shaving it down, or?
Sometimes it's shaving. If the hump isn't too big and there's some bony irregularities, you'll shave it down. If it's a very large hump, then we use an osteotome, which basically is a chisel. And we can take off, you know, the largest part of the hump. When you take the hump down, though, because the nose is kind of pyramidal shaped, if you take the hump off, what you're left with is a bit wider than you started, you know, so you have to close that roof, you know, to bring the edges together. So to do that, we crack the bones down the side, again with a very small osteotome, where we just make a series of little breaks in the bone and we can move the bones together.
Many times it might not be that you just don't like your nose. It could be something that's caused from an injury. What about nasal reconstruction?
Well, nasal reconstruction is basically about replacing parts of the nose that have been damaged, either by cancer removal or by trauma. Those are the most common reasons. Skin cancer is very common in this area, and if you get a significant larger defect, then that needs to be repaired. That may involve borrowing skin from somewhere else and applying that as a skin graft, or more commonly we will use a rotation flap, a small localized flap where we can rotate similar tissue into the defect. The tip of the nose, the skin is very tight, so there's no spare skin to work with there. But on the top of the nose, you know, towards the top, there's more mobility. So in stepwise fashion, you can move that tissue down to close the tip defect, and you can pinch things together on the upper part of the nose to close the donor site defect.
So if someone's going through this particular procedure, I mean, what can they expect? I mean, because most people, when they're approaching procedure, the two things that they want to know about, of course, is it going to hurt, and what is the recovery time? Right.
These surgeries are done under general anesthetic. I prefer that because there is some bleeding at the time of the surgery. You don't want that blood, you know, going into the wrong place like your windpipe. So we use an oral tube that protects the airway whilst we're working. Typically, surgery takes about 2 hours. It's an outpatient procedure.
Outpatient?
Yes. You may have splints or packing on the inside of the nose for a few days, and we put one on the outside as well, just to stabilize things during that initial healing. There'll be some bruising. Sometimes you'll get a black eye from the bone work. But the splint's off by a week for sure, and things are settling down pretty well in that second week.
A lot of viewers watching right now, and what would you say to them if this is something that they're considering? Maybe they're not happy with the way that their nose looks, and they haven't been happy for years. Maybe they had an injury or something like that. What would you say to them?
They should come in for an assessment, and we can see what concerns them, and we'll have a look internally to see what's going on with the internal structure, and then we can decide what approach would work best for them.
And of course, you definitely want to deal with an expert if you're thinking about this particular procedure, and you want Renewal MD. Dr. Huntley, I want to say thank you for coming in and talking with us about rhinoplasty and providing us all the information that you did.
Well, thank you very much for having me. It was fun.
It's always great to see you. If you'd like more information on Renewal MD or rhinoplasty or any of our Coastal Experts, just go to our Coastal Experts page. You'll find that on our website, wsav.com.